A 55-year-old man with a history of hypertension, chronic kidney disease, CKD, stage 3, and type 2 diabetes presents to the emergency department with profound fatigue, generalized weakness, and new-onset confusion. He reports missing his last 2 dialysis sessions. On arrival, he is found to have hypoxia with an SpO2 of 88% despite oxygen supplementation, although his arterial oxygen saturation, SaO2, from a recent ABG is 97%. His medications include lisinopril, metformin, and furosemide. His blood pressure is 145/90 mmHg, and heart rate is 90 per minute, laboratory results show. Sodium, 135 milliequivalent/L, normal, 135 to 145 milliequivalent/L. Potassium, 7.5 milliequivalent/L, normal, 3.5 to 5.0 milliequivalent/L. Bicarbonate, 12 milliequivalent/L, normal, 22 to 28 milliequivalent/L. Serum creatinine, 5.0 mg per deciliter, baseline, 2.5 mg per deciliter. ECG, peak T waves, widening QRS complexes. ABG, pH 7.2, PaCO2 28 mm of mercury, HCO3 12 milliequivalent/L. Serum glucose, 65 mg per deciliter. What is the most appropriate immediate intervention? A. IV calcium gluconate. B. Hemodialysis. C. Sodium bicarbonate infusion. D. Insulin and glucose. E. Nebulized albuterol. Please pause and write your answer in comments. Now let's find the correct answer. Explanation. This patient presents with severe hyperkalemia, K plus 7.5 milliequivalent/L, evidenced by his ECG changes, peak T waves, widened QRS. He is also showing signs of metabolic acidosis, pH 7.2, and missed dialysis sessions, complicating his renal insufficiency. The SpO2 and SaO2 discrepancy suggest poor oxygen delivery, possibly due to acidosis and severe hyperkalemia affecting tissue oxygenation. The immediate priority is stabilizing the cardiac membrane to prevent life-threatening arrhythmias, which is best achieved with IV calcium gluconate, option A. Calcium rapidly stabilizes the myocardium, reducing the risk of arrhythmias. Other treatments to lower potassium, such as insulin and dialysis, are initiated afterward but do not act as quickly to prevent arrhythmias. B. Hemodialysis, ultimately necessary for hyperkalemia in CKD, but it is not the first step in stabilizing the heart. C. Sodium bicarbonate infusion, may help treat acidosis but is not as immediate or effective in stabilizing the heart as calcium. D. Insulin and glucose, helps shift potassium intracellularly, but does not work as fast as calcium for acute arrhythmia prevention. E. Nebulized albuterol, promotes potassium uptake by cells but is slower acting and not as reliable as other methods. Key takeaway. In cases of severe hyperkalemia with ECG changes, the immediate priority is stabilizing the cardiac membrane with IV calcium gluconate to prevent fatal arrhythmias. If you loved this video, please like and hit the subscribe button. We will keep uploading new questions on a regular basis.